I got you on.
You ready, Miss Al?
Okay. Yes, I will be Miss Trisha's secretary today.
I'm going to attempt to explain this to you guys just because it's something that we as technicians deal with all the time, especially my last job. The job before that I did as well, but especially in my pediatric oncology, because I worked at an infusion suite. And so we had to be sure that when the doctor writes for something in such a way that we're putting it in exactly what they're asking it to go in. Because when the nurses get this also as well, they're going to depend on what we've done to set up their flow rate, right? How long their infusion is going to be for their patient. And if you have at an infusion suite, you may have 7 patients that day getting infusions. And if you're over every single time, then you're going to be there till late at night, and your patients are going to be upset because their infusions are going to go over the allotted time. And some of these infusions are big volumes and they go over hours. So they may be there 7 or 8 hours. And if you don't deal with the overfill, then that means their infusion is going to go over the time allotted. And it'll upset the patients and the doctors, and the nurse will be there late and it'll upset her. So I want to explain overfill, just so you know too, that in your pharmacology practice textbook, chapter 13, page 581 gives you a table that it gives you examples of overfills in IV bags. So like Ms. L said, typically our manufacturers will give us what the overfill is in the bag. Now, I don't know why they do the overfill, what really their reasoning for that is. I've really never known that. I just know that they do. So what we're talking about is that here's an IV bag, all right? This is a 1 liter IV bag, all right? And so we have multiple size IV bags. This one's a 250. We have 50s, 100s. They may go up to, we may make them into 2 liters, usually they come in up to 1 liter is what we usually get them in. But so when that bag comes to us, even though it says that there's 1,000 mLs or a 1 liter bag, which is the same thing, of normal saline in it, there's actually 1,050 in that 1 liter bag. So before we even put any of our medication that we've drawn up, any of that drug in there, there's already 1,050 in there. So if our doctor has called for something to be in 1,000 ml, before we even do anything to it, we already have more than we started with, right? So in this problem that Ms. L has given you, we have mitomycin, it's a 40 milligram. And so it's telling us the 0.5 per 1 ml is actually our concentration. So we're going to reconstitute our vial, and our concentration is going to come up to that 0.5 milligrams per ml. So it says it wants to be added to 1,000 mLs of normal saline to be infused over 6 hours. So we need to know if this is going to, and it tells us that we're going to assume that the overfill is 50. So it's giving us this information. So it says assume 50 ml overfill for that 1,000 ml bag. So we're going to find out a couple things. We first of all already know that we have 50 mLs of overfill. So that's something that we need to deal with. But we also need to find out how much drug we're going to have. So after we reconstitute our drug and we find out that doctor wants 40 milligrams, we're going to do ratio proportion to find out how much drug that we're going to have as well. Miss L, she's drawing you a nice little picture here too. She's so cute. So we're going to do ratio proportion. So we know that we have a 40 milligrams, correct?
Actually liking this, that I'm your secretary. I
can like this? Okay.
Yeah.
So what do we know? We know that we have 0.5 milligrams per 1 ml. So we need to find out, oh, I apologize. I didn't know my phone was on. Sorry, guys. Okay, so we know already we have 0.5 milligrams per ml, and we need to know how much 40 milligrams of this mitomycin is going to be. So that's going to be our second. We know 40 milligrams, so we're going to put that on top for our next one, Miss Al. There you go. And we're going to put it over what? X mLs, because that's what we need to find out. When we get all of this 40 milligrams of mitomycin, because that's what the doctor is called for, how much liquid are we going to have, right? How much more volume are we going to have to put in this bag? So we're going to do cross multiplication. And so if you do your math, you're going to get, you'll have 0.5x is equal to 40. So you're going to divide your 40 by 0.5. And your X is going to be equal to 80. So we know that we're going to be adding, as a technician, we're going to be drawing up 80 mLs to be able to complete this prescription that the doctor has given us to make sure that patient is going to get the 40 milligrams. So 40 milligrams of mitomycin is equal to 80 mLs, okay? They're interchangeable. As far as we know, they mean the same thing right now. And we know it's going to be added to 1,000 mLs of NS. So our first question is, show how to calculate the amount of sterile water diluted to be added. So we already did that, right? And then our second question is, show how you would estimate the amount of overfill plus our diluent. So we know we have 50 mLs of diluent and we have 80 mLs of drug. So we're going to add those two together. So it's going to be addition. So we're going to have 80 plus 50, and that will equal 130, right? So we have our overfill in our drug gives us 130, and we still have our 1,000 mLs of normal saline. So that's going to be part C. We're going to put in what is the final volume is going to be the 1,000 plus 130. Because if we add all of this together, this is what we're going to have. Okay, 1,000 plus 130. That was what we're going to add, our 80 plus that overfill. So now we need to figure out that they're asking us, because they must have a 10% rule. They must be okay with a 10% amount of overfill in there. The place I worked at, there was 0. So you took out all drug and all overfill and got exactly what the doctor was asking it to go in, the 1 liter. But here they're telling us that 10%, we need to figure out, is this 10%?
Let's pause right here.
Yeah.
Did you follow? From first, from A, B, C. So this one, we calculated this to be 80, right? And then you were given that 50 ml. So for this one, 50 plus 80, you got 130. And then the next one, you have 1,000 ml bag, which is this one, plus this 130. So it's 1,130 ml. Did you understand at this point before Ms. Trisha proceeds any farther? Yeah? Okay. Now we have to know what 10% is, right, Ms. Trisha? We're on
Yes.
D now.
Okay.
Okay.
So we can figure out 10%. We can use our calculator, or are you going to do it a different way, Miss Al? I just am going to go by the calculator and figure out 10% of 1,130, right? So what is 10%? of 1,000, yes, is 100. So we know that our bag can be 1,000 plus 100 at the max. Very good, yes. So is our bag above that or below that or right at it? Joey? It's above it, yeah. So we're 30 mLs over, right? So based on our answer, what adjustment in the volume of the base solution is necessary then to meet that 10%? How much would we have to take out before we even put our drug in?
20 ml?
How much?
30.
Yeah, 30. And now we want to make sure, and now this is how we get the answer to this problem, but you got to remember all of this that we're going to do, I'm telling you as a technician, because you're never going to want to put everything in there, including your drug, and then take the 30 ml out, because you're actually taking drug out then. You're going to take the 30 out of that IV bag. So you're going to have to be able to do all of this math before you even go in to make your drug, because you're going to get that 1,000 ml bag, which is 1,050, right, with the overfill. And we're going to take out right at the, before we do anything else, we're going to take that 30 out. We're going to set that syringe aside and we're not going to use it. That's going to come out. The pharmacist will have to check that, make sure we withdrew that. Now we can draw up our drug. We can draw up that 80 ml and add it to that 1,010 and still be within our, or I'm sorry, Miss L, 1,020, and we can add our 80 and still be at our 10%. Does everybody understand that? Joey, Eileen, Neela? Do you understand that? I know you're good at math, Neela, but this is kind of a little bit more. Do you understand it? Okay. Elizabeth, I know you understand it because we went over it last night until you did. Do you understand?
You said we have to, don't we have to withdraw 130, not 100?
No, well, if you need to get it to the, just to the exact 1,000, but they're telling us we have a 10% here. We can work with 10%. So we're within 10%. So we can just take out 30 and still be within 10%.
Okay.
Okay.
If it said specifically that you can have a 10% overfill, but we don't want the overfills. So you follow what the manufacturer always says, how much to withdraw. And it said here specifically, there's a 50 ml overfill. That means you have to withdraw that 50 ml overfill, and that will give you an exact amount. Okay? Is that clear? Yeah? But if you're basing it, what Ms. Trisha's trying to say, if you're basing it that we're allowed 10% overfill, then you only take out 30.
Yeah, if you're allowed 0, then you take that 50 out plus whatever the volume of your drug is going to be. In this instance, it's 80 mLs of that mitomycin.
Is that clear? Yeah? Okay. That's the only thing I'd like to cover today so that all of the topics were covered, okay? But know that you are going to be tested on everything: conversions, day supply, quantity to be dispensed, lots of questions on ratios of IV bags or practice on the normal saline, on the D5W, et cetera, et cetera. And then this particular one, the overfill. Okay, we've covered them all. There's nothing that we didn't get to cover. If you want more practice, use your textbook. If you want to clarify certain things, go back to the video lessons. Okay, I don't have a video lesson on overfill. That's why it's good that we're going over this. Okay,
Chapter 13, page 581 explains.
There you go.
More. And so maybe with Miss L, me, and the
book,
you guys will have what you need to.
right. So I explained this. I sent you the link to the video, and it wasn't clear. That's why I told Ms. Trisha, can you explain it to them today live? Because that's another version. And then she said exactly where you're going to find it on the textbook, another version. 3 versions, you choose one.
Yeah, and in the textbook, just so you know, they have you, for some reason, change your concentration of the 0.5 milligrams per 1 ml, but that's not really a necessary step. I feel like, because it's the exact, they're interchangeable, you know, it's kind of like if you have fractions, you know, one is exactly the same as the other. So, and that's what it is. You have 0.5 milligrams per ml, and they have you change it over to 5 milligrams per 10 ml. Well, they're the exact same things. So why make that step? Because that's just another step that you could make a mistake. So you can actually, with the 0.5 milligrams per 1 ml, still get your correct answer.
Correct. Okay, Ms. Trisha, let's clarify. Question E, if they're asked this question on the test, do they base it on the with 10% or without 10% overfill? Their answer on the last one. What should their answer be?
Pardon me?
What should their answer be on E? Is it based on letter D or is it based on the initial prescription? Will you check the answer key?
Because
this can be confusing.
they want you to bring it to 1,000. So they, like I told you, they want no overfill.
So based on this one.
Yeah, so they don't even want you to consider 10%. They asked you, is it more or less than 10%? But they want to know how much you need to adjust it to be able to get the necessary solution, which is the 1,000.
So the answer is not 30. If this is connected to this problem and 10% is allowed, like what we keep saying, take out 30 ml. Okay, that's why I asked Ms. Trisha, verify that with the answer key, if we wanted to base their answer on letter D, but she said no.
Because they give you, it said, because your volume at the end, right, we talked about will be 1,130.
Right, but they wanted your final volume to be 1,000 ml only based on this prescription.
So your answer to letter E would be then the 130, not the 80.
You got it? Nila, is it clear? I see your wrinkled forehead.
So the answer to number E is one.
Number
It's one. Yeah, it's
Letter
130. And the reason, Neela, is it's 80 was the drug that, remember, the mitomycin came up to 80 ml. We drew that up in a syringe. That's the medication that we're going to give to the patient, okay? The 50 is the overfill that comes in the bag. So I have this bag right here, right? And before I do anything with it, this has 1,050 mLs in it. So to get it to the true 1,000, which it tells me it has, I have to take 50 out. Okay, but because I'm putting 80 drug in there, now it's going to be what? 1,080. So I got to take that 80 out too. So I'm going to take 50 plus the 80 in this. So I'll take 130 out. Then when we put the 80 in, then we're 1,000.
You get it now? This is how you're going to see the prescription.
This is how you'll see them.
1,000 ml. You'll see QS add
QS.
1,000 ml or QS add 1 liter. What does that mean? Quantum sufficient addendum. Add a sufficient quantity to make it 1,000 ml. That's what it means. So on a prescription in the hospital, you're going to see it QS add or QS 1,000 ml. When you see that, it means add a sufficient quantity to make it a total of. You get it? So that's how you're going to see it in a prescription. And I don't want you to panic when you see that, okay?
The whole 10% kind of threw you. It was kind of a little extra something added in there. So you could assume that they were going to allow you a 10%, but that's not what they're looking for. Yeah. So
Yeah,
you gotta be cautious of that too. And like I said, there are some that allow some overfill, but because your rate isn't going to change and your time's not going to change, but by a few minutes. But when you get into the larger volumes and you're talking an overfill of 130, that's a lot more time added on to that infusion time for the patient. So that's why. And it may be because the drug can only go into a maximum. It's only maximum concentration can be diluted down to that 1000 mLs, or, then the patient's not going to get the proper therapeutic. Yeah.
The best way to put it is the manufacturers are allowed up to 10% overfill. Remember that sample that I showed you yesterday? You remember the Yukon Health? Okay, I'll pull it up. So I'll close this one, I'll share again. And you can see that based on their cheat sheet, I'll go back to my pharmacy math. This is the last of it, and then we're done. I just wanted to show you this, Yukon Health. Okay. Remember I showed you this yesterday? Okay. And if you're gonna notice here on Baxter, labeled volume 1000, but they do have a fill range between 1020 to 1070. Okay. And they said that there is an estimated overfill of 58 ml. Okay. And then here on the 100, you see that it's up to 110 because manufacturers are allowed up to 10% overfill because they can't put the exact amount in there. This started when we used to use bottles. Okay. This started when we used to use bottles as IV bags, but they're bottles. Okay. So there's no exact amount that's getting in there. Okay. But they get to figure out what was the overfill. But on our end, once it gets to the pharmacy, we have to make it accurate. That's why the first step is to pull that overfill out. You get it? Okay. So I wanted to clarify that particular question on D and E because I don't know if they're connected to each other, okay, or not. But they're not. They're independent of each other and they're based on reality. Because sometimes math problems are just thrown out there, not necessarily based on reality. It's just for the purposes of checking whether you can solve the problem, right? Okay, this one is based on reality. This particular problem that we gave you is based on reality, okay? Assuming there was a 50% overfill, okay? And manufacturers are allowed up to 10%. But the letter E question, or according to Neela, the number E question is
the number E.
is an independent, it's Christmas, okay?
Yeah.
So the number E question is independent of the other problems, okay? It's asking you, what are you gonna do all together, okay? What are you gonna do all together, okay? So you pull out a total of 80 plus 50, which is 130, because you've calculated that you need to inject an 80 ml drug, right? Which is going to be a plus 80, but there's an overfill of 50. So you're going to take out that 50 as well to make it QS add 1000 ml to the T 1000 ml. Again, manufacturers are allowed 10% overfill, but we are not going to do an overfill. Okay, it's just letting you know. If you see, they try their hardest here. They try their hardest not to have an overfill. Okay. So right there, okay? If you see here, glass, okay? Because our original IV bags are in glass. Remember I told you my story in the past? When I was in the hospital, I would measure the salt, I'd put it in a bottle, I'll add the water, I'll seal it, and have it organized on a cart, and somebody will pick it up, send it for autoclaving. And we use that. We reuse the bottle. We sterilize the bottle. So hallelujah that we have IV bags now. You can tell that Miss L is old school. She went through that process. And I thought I was old school. And then somebody came and said, oh, you're lucky. We were asked to make glass. We learned glass tubing. said, whoa. So that's crazy. They had to make glass, like ampule, glass
Oh my
heating
gosh.
or glass. I know. So that's more old school. I just prepared it in a glass bottle. Okay. I remember it was swing shift in my hospital that does that. Okay. So it's ready for the next day. Okay. Any questions? This has been a really good class. I know we're online almost every day, right? Except for Monday because we were at the campus. So I really seriously thank you guys for transitioning with us. And there's not a lot of whining, really. I'm so happy and I'm so lucky to have students who are not whiners. Because sometimes I'll get a lot. Okay, believe me, I'll get a lot. It's just part of it. And I think your group, as well as the others, just like the instructors, adapted really well and are flexible. Not that we want it, but it's a change, okay? And we've successfully transitioned to it, okay? With the help of your instructors and with your help being on the understanding side, I'd like to thank you, and I will see you guys on Monday. You have questions? No?
9 a.m.
Yes, because I want 3 hours of lab with you guys on Monday, okay? Don't be late, Joey.
Got it.
Hint, hint, wink, wink.
Right. Okay, so we've covered everything for your final exam. Don't forget Tuesday's final exam. I'm just waiting on your final exams. I've adjusted the grades. I haven't gone to the math part, but we'll do that. We still have one more quiz, a paper quiz, right, Mr. Shah, that we need to check. And Mr. Shah and I will talk about that. It's the one that you submitted, right? There's a paper quiz that I asked you to submit, upload. I think that's volume. Anyway, I'll check. I don't see anybody missing any requirements for math. So I'll let you know if you did miss anything. Okay. But your 225 is updated. It's up to date grade. Okay. Any more questions? I'd like to have 10 minutes break before we jump in the meeting. Okay. I'll see you guys later.